Hello everyone, my name is Ash and this is my colleague.
Shamsia.
And this is my colleague.
Mimi.
And this is my colleague. Hello everyone, in this video we'll be talking about how mood stabilizers work, which are commonly used in mental health disorders as well as other illnesses. I'll briefly be discussing about how the medication works in your body today. But it's also important to know how long it takes for the medication to be active. Normally, medications such as painkillers, antibiotics, or even cardiac medications, they take anywhere between 30 minutes to 24 hours to work, whereas it's a bit different with mood stabilizers. They can take up anywhere between 2 weeks to be active and 4 to 6 weeks to fully reach their potential to function. So that's when you start feeling it. I'm going to be sharing a graph with you today that will elaborate a little bit about how these mood stabilizers work in your body. Now let's imagine this graph as your body, okay? So what happens? So we've got times in week and we've got the blood plasma concentration. So when the patient takes the medication, what happens is at week 1, it's approximately just there, just under the minimum effective concentration. Now, if any medication is not effective, it'll be below minimum effective concentration. And if it's too high in your bloodstream, then it will be above the toxic range. So what we need the medication to be at is a therapeutic window. So this is in between the toxic range and the minimum effective concentration, which we're going to call as MEC. As you can see, the medication becomes effective in week 2, and as it goes to week 4, it becomes fully active. And when it's at week 6, it's still active in your system, but it's constant in this case. Now, this is how medication in your body technically works. And that's why patient participation is extremely important when it comes to taking medication at the right time, with the right route, right dose, and the right drug, and certainly by the right patient. One of the ways to obtain information on how effective the mood stabilizers are is to do therapeutic drug monitoring, which usually your doctor conducts. This helps to measure the concentration of drug in your blood plasma level, just like the graph that I showed you previously. So it determines where the drug is sitting at, whether it's above the minimum effective range, whether it's below, or whether it's above the toxic range.
Mood stabilizers are used for treating symptoms related to mania, such as anxiety, anger, depression, impulsivity, or attempts of self-harm, which are related to bipolar disorder. Mood stabilizers are used as relapse prevention, which is reoccurrence of mental illness episode. It is important for you to participate in relapse prevention to ensure long-term success in maintaining well-being. Medication non-compliance is a major risk factor for relapse. There is clear evidence that taking medication as prescribed significantly reduces the risk of relapse. However, evidence suggests that many people do not take their medication as prescribed. There are a couple of reasons as to why clients do not take medication. Firstly, the side effects can be distressing and socially disfiguring, for example, adding weight. Then, lack of knowledge about the illness. Clients can believe they are not ill and not take medication. Clinical features of mental illness, such as paranoia or anxiety that may be present in certain mental illness. Cultural beliefs and traditions of people that can prevent taking medication for mental illness and seek alternative practices. And finally, accessibility and affordability of medication. Many researchers have stated that the psychopharmacological mechanism of mood stabilizers is unknown. But there is research that states lithium is thought to modify the production and turnover of certain neurotransmitters such as serotonin and dopamine, which helps to regulate mood. And the anticonvulsant drugs such as carbamazepine is originally made for preventing and treating seizures, but this medication is also used as mood stabilizers. All these mood stabilizers can have a negative side effect, which can lead to medication non-compliance. Medication non-compliance is a major risk factor for relapse. There are a couple of steps you can take to be compliant. Firstly, simplify the medication regime. For example, having weekly meds container and a calendar. Secondly, social skills training to improve interactions with doctors and health practitioners. Thirdly, have a journal to write down how you feel and your symptoms.
Hello, so today I'm going to be talking about the major side effects associated with stabilizer, and I'll also be talking about the route of administration and the dosage. So there are 5 individual drugs that can be used as mood stabilizer. These are lithium, carbamazepine, lamotrigine, sodium valproate, and acinorphine. The route of mood stabilizers can be taken orally via tablets or oral solution. The dosage range for mood stabilizers vary from patient to patient. For example, lithium can be taken 700 to 1000 milligrams every 12 hours, but dosage can be increased by the doctor according to the serum level. For carbamazepine, 100 milligrams is taken 4 times a day or 200 milligrams for twice a day, but it may be increased up to 1.6 grams daily according to the patient's report. Sodium valproate, the average total daily dose is 1000 milligrams to 2000 milligrams daily, or it can be divided into 1 or 2 dosage up to 2500 milligrams daily. One of the ways to find out the drug function is to do therapeutic drug monitoring. The monitoring of therapeutic drug involves measuring the concentration in plasma, serum, and blood. The information is used to individualize dosage so that the drug concentration can be maintained within a target range. So the most common side effects for mood stabilizers are weakness, nausea, thinning of their hair, loss of appetite, tremor, confusion, and fatigue.
So we've talked about mood stabilizers in general, including their pharmacology and who and why would take the drugs, and also what side effects to look out for. We've also gone through the impact of side effects on the client and how mood stabilizers can affect the ability to function. But the actual administration of any drug happens before any side effects shown. So we're going to go through the nurse's role in safe drug administration and management, and just really overview what the nurse's role is in all of this. The role of the nurse in safe administration of medications is really important because medication errors can lead to adverse events such as overdose or physiological reactions like allergies and whatnot. And generally they follow 5 to 6 rights of administration, which are the right drug, the right dose, the right route, the right patient, and the right time. And some healthcare organisations use the right reason, which is to avoid giving drugs that are misprescribed. Now, it's really integral that nurses check each of these rights before giving a drug, and that's to ensure correct and safe administration, which can lead to a progress of treatment instead of taking a step back. Another role of nurses involving safe medication management is to observe clients and ensure that there are no adverse outcomes or a potential plateau of progress. These drugs are prescribed so that they can manage the symptoms of bipolar and other illnesses. So if we observe the changes, like a worsening or lack of improvement in the symptoms, then we know that we need to discuss it with you, the client, and also the psychiatrist or the doctor to find a way to overcome and progress past the issue. Finally, one of the most important roles of the mental health nurse is educating the client so they can go home or out into the community and really be independent in their own care. The education should include self-medication and managing side effects and what to look out for, so they know when they need to make more appointments, and so they can just ensure the highest level of functioning and thrive within themselves. We're going to move on to talking about actual education on self-medication and also ways that we can find a medication regime to prevent relapse.